Today I'm at Village Smile Care. It's a dental office right here in Mount Horeb, and with me is Dr. Angela Cody. Dr. Cody, you had given me a list of frequently asked questions that you seem to hear regular concerns from patients. Let's dive right in with one of the first ones.
Sure.
Here is, sometimes we need a crown. Why do we need a crown? Or is it why?
Yeah, and a lot of patients will ask, well, can I just get a filling instead? And you know, we do a lot of fillings, and fillings are great for smaller cavities. However, when a tooth is very structurally compromised, it's had big fillings in the past, it has cracks in it already, a crown really is the best option. And even though it might be more expensive, it's a good investment rather having a filling that will have to be replaced more often due to leakage or chipping. Also, there's a high risk if we see a large filling and what's left of your tooth is very fragile, and we see those cracks. If they break, sometimes it breaks into the nerve and someone needs a root canal, and sometimes it breaks below the bone and then the tooth has to be pulled. So as much as it's more of a process, in the long term it's a good preventative measure to protect your teeth. The crowns are out of porcelain or metal, so they're a lot stronger than the filling material and can protect the teeth more.
Oh, an ounce of prevention, it sounds like, in that case.
Yes.
All right, you mentioned earlier something about deeper cleanings. I haven't really heard of that, and sometimes you need to recommend a deeper cleaning for patients?
Yeah, so some patients come in for their regular cleanings, and that's great for people who have healthy teeth and gums, but over half the U.S. population has some form of gum disease, from gingivitis to periodontal disease. It is.
Yeah.
It's very prevalent and people don't know about it, and it's not always painful, so they don't even know they have it. So anyone that has bleeding gums, things like that, they do have gum disease. In those instances, we do have to go below the gums to treat the infection, and people will have deeper gum areas to clean. And so in that case, deeper cleaning is more the generic term, but we call it scaling and root planing, and that's a procedure to go treat the deeper gum infection.
Oh, it is going deeper.
Yeah, it is.
Okay, so the rest of us sometimes are coming in every 6 months, but some folks need to come in more frequently, every 3 to 4 months?
Yeah, so people who have had the deeper cleanings or the periodontal treatments, we want to maintain that so they don't have to keep doing that procedure over and over, and also stay on top of it. It's kind of like diabetes, it never goes away, we just try to control it. So we want to prevent bone loss, so by coming in more frequently, the patient can keep it under control. Other instances too, where somebody might be immunocompromised, or patients that get decay at a higher rate, coming in more frequently is a good preventative measure to catch things early and prevent things from getting out of hand, or to help us maintain that.
Like anything, maintenance is so much easier than,
Yes.
than a big overhaul, and cleanings
Yeah.
are actually more comfortable if you do come more regularly. There's, I guess,
definitely.
less work involved.
Yes.
Okay, let's talk about fillings. So back in the day, we had the silver fillings, and now we get white fillings. Are they better? Are they worse? Are they purely a cosmetic thing?
Yeah, I mean, obviously the white fillings are certainly more cosmetic. However, there's some health concerns as well. The silver fillings do have mercury in them, so that's not the healthiest. But aside from that, the silver fillings had to be a certain thickness because they could not bond to the tooth. The newer white fillings can bond to the tooth. So if someone has a very small cavity, we can do a small filling. In the past with the silver, we had to remove more tooth just to get the filling to stay. And then without that bond, they would leak over time. And then, like we talked about needing a crown, also the metal would cause cracks in the teeth over time. And so the white is a little more like our natural tooth, and it bends and flexes similarly, so we don't see the fractures.
So do we even want to get silver fillings anymore?
Well, we don't do them in our office, so I'd recommend the white if you can do that.
Oh, that's really interesting.
Yeah.
I didn't know about the bonding part.
Yeah.
Okay, x-rays.
Yes.
Yeah, it seems like that they're always recommended. Why not a visual exam? What is an x-ray really giving us?
Well, the visual exam, all we can really see is the teeth and above the bone. There's a lot going on with the bone and the root structure that we would miss without x-rays. So we can't see any type of root infection, we can't see bone loss, we can't see any lesions in the bone, which might be a pathology starting. We also can't see the cavities that start between the teeth. So by doing the x-rays, we can treat things earlier and catch things before they become a large problem.
Sounds like a lot of things, actually.
Yeah.
That's amazing.
Yeah.
Okay, one more. Kiddos. When do kids generally lose their first tooth?
So kids will get their first baby tooth at 8 to 12 months, and then around age 6 is when they'll lose a tooth. It can vary from 5 to 7, so I tell parents not to get alarmed if they're a little off that schedule. There's a great resource, which I'm sharing right now on the screen, and also you can get it on ada.org. It's a tooth chart that we give our patients so they know each tooth when the child should lose it, and it gives a range because it can vary.
I suppose so. Alrighty, thank you so much.
Yeah.
Maybe one of those questions were yours. If you have your own questions, you can give them a call or check out their website for other FAQs. We're Girl Talk, and we'll be right back.